We offer surrogacy to a lot of patients in our unit. But even though we do so many cases, it constitutes only 5 to 10% of our practice. Because primarily we are a very high-end tertiary care unit which caters to patients for IVF. So therefore our success rate is nearly in the range of 50 to 60% in surrogacy. We get a lot of patients who have failed other places and then come to us and taken home babies. This is because of a very good laboratory backup. And then we really work on the surrogates. We do the hysteroscopy of the surrogates, we investigate them thoroughly, and a lot of blood tests are performed to see if she is absolutely normal and will give very good results. Just to take you back a little bit, what are the indications of surrogacy? We do surrogacy in a lot of patients who've had cancer treatment and have had to remove the uterus, or we do surrogacy in patients who have had a lot of bleeding or postpartum hemorrhage and have lost their uteruses to save their lives. In India, a lot of patients are seen with damaged uteruses following tuberculosis, which is very common in our country, or even following sepsis after abortion. If abortions result in infection, it severely damages the uterus, and then these uteruses cannot carry a child. Recently, we've had a lot of patients who've come with recurrent abortions. These are the patients who have repeated abortions starting from the first trimester to even 16th and 18th week because of the weakness of the mouth of the uterus. And these are the patients who would really benefit and have benefited from surrogacy. Then there is another category of patients where there's recurrent IVF failure. This is probably due to some inherent factor in the uterus where the embryo just does not implant. And in these patients, when we've done surrogacy, we've got positive results. So I think this is a group of patients which is very important. We do a lot of surrogacy for our Indian patients, but of course, a lot of patients from abroad also come and do surrogacy with us. The most important point that we consider when accepting people from abroad is that we need a letter from the embassy saying that their country permits surrogacy, because it's very important so that you can take the child back home with your passport if your country permits the surrogacy.